Hi, I'm Dr. Zoe from Chi Medicine in Moonee Ponds, Melbourne, Australia. And I'm just here to introduce myself a little bit for people that are looking at the about me and I guess wanting to know a little bit about me and why I do what I do. And so I guess I've always loved problem solving. It's something that excites me and gets me going, and fertility I've had my own struggles with that. So I was told that I wouldn't be able to have children when I was 21, and that was one of the hardest things that I think I've ever gone through. I mean, I believe that I can now with all the stuff that I know, but I guess being a mother is something that I've always wanted. It's been my number one goal. When I was younger, I didn't care about so much my career or anything like that. It was always I wanted to be a mother. So I went through a lot of personal development in kind of understanding that and what that meant to me. And if I wasn't able to have children, how would I still create the family that I want? And it was tough. It was really tough. And so I think that's why I've kind of gone to using acupuncture for fertility and this problem solving in why, how, until I 100% know that there is absolutely no way that you could fall pregnant, then okay. But even then, if you can't and you've used all kind of avenues of understanding why and how, then so be it. All right, how can you create the family that you still want? So for me, pregnancy and having a baby is that ultimate goal, and I know there's so many of you out there that also have this goal that just means more to you than anything in the world. And so I want to know why. Why aren't you falling pregnant? What's kind of causing this? Sperms decreased by 50% in the last 15 years or something. There's been multiple generations on the pill. So what is it specifically that's not allowing you to fall pregnant? Are you timing right? Are you getting, the right amount of nutrients? Do you have enough blood? This is everything that I go through, one by one, so that I can actually work out specifically the reason why you might not be falling pregnant. And if that is something that we're unable to do, IVF is amazing at some of the things that it can do now. We will achieve these goals. And even if IVF isn't something that we can do, then we can work out what this means to you, like I did in my own journey, what will still allow us to have what we're looking for in this creating a family, and how we're going to achieve that. IVF also can be one of those huge overwhelming things that we're what are we doing? What's going on here? You're just kind of going through the motions. So I love to teach women to be in control of their fertility. So what's happening? Why is it happening? Do we have a diagnosis from the IVF world? And how are they using that diagnosis to fix the problem? And it always comes back to fixing that problem to achieve these big goals that we have. And so I guess the epitome of having this goal of having a baby, I don't stop when you fall pregnant. That's just, I'm going to the goal, and so I keep going. So pregnancy can be something that we get swollen feet, or we might have pain, we're not sleeping properly. I mean, we can't take the problem away, but we can absolutely help to manage some of those signs and symptoms to just help you to enjoy your pregnancy. And then obviously that labor induction is just something where we're going, especially our first child, leading up to something that's the unknown, you don't know. And I'd be scared too, everyone's scared when they're going up to that first pregnancy, that first labor. So that's something that I used my NLP to kind of work out how we could work around that, because everything I do is about allowing you to control. So there's things like meditation and hypnosis and stuff that I can do in the clinic room where we can help you to minimize that stress and help you to kind of ease through and get the birth that you hopefully want. And sometimes like we can't always have the perfect birth, and that's okay. But the goal is the baby, and so helping you to accept and helping you to ease through, you know, that new kind of transition in life into becoming a mother is something that I love and I feel really passionate about. So I guess they're like my main things, like make this baby, how are we gonna make this baby, and like let's get this baby is just like everything to me. So if you're struggling, if you're unsure, let's work it out. Come in. I like you to be in control. I know some people just don't really want to be in control. That's okay too. If you are someone that's really fast, like give me all the steps, or someone that's just like one thing at a time, however you want your fertility journey to be, that's up to you, and I'm totally on board with that. I just want to help you achieve the goals that you have. And so I have the tools, and I studied really hard, ins and outs and all of this. So come in and see me and let me know, you know, what's your goal, and I will help you to tell you how to achieve it. And I hope you have a wonderful day, and I'll see you soon.